L-Arginine, L-Citrulline. You've probably seen these everywhere. Supplements claiming they can boost your blood flow, fix your erections, and bring your performance back. But here's the real question no one answers honestly. Do they actually work? Or are you just wasting your money? I'm Dr. Ella Reed, your trusted men's health advisor. What they do in your body, how effective they really are, and most importantly, which one you should consider if you're dealing with erectile dysfunction. Understanding the root of erections. Before we dive into the supplements, you need to understand one key concept. Erections are all about blood flow. If blood cannot properly enter and stay in the penis, you will not get or maintain a firm erection. And the chemical responsible for triggering that blood flow? Nitric oxide. Think of nitric oxide as the ignition switch. Without it, nothing happens. With it, your blood vessels relax, widen, and allow blood to flow freely into the erectile tissue. So naturally, anything that increases nitric oxide has the potential to improve erections. L-Arginine, the direct nitric oxide booster. Let's start with L-Arginine. L-Arginine is an amino acid that your body uses to produce nitric oxide. When you take L-Arginine as a supplement, it increases nitric oxide levels in your bloodstream. And what happens next? Your blood vessels relax, they expand, blood flow improves. And this leads to better erectile function. But there's more happening beneath the surface. L-Arginine also increases something called cGMP, a molecule that plays a critical role in maintaining erections. In fact, many prescription ED medications like sildenafil work by increasing cGMP levels. So in a way, L-Arginine is supporting a similar pathway, just more naturally and less aggressively. Why nitric oxide matters more than you think. Here's something a lot of men don't realize. Nitric oxide production decreases when your blood vessels are damaged. And what causes that damage? Conditions like diabetes, high blood pressure, heart disease, atherosclerosis, plaque buildup in arteries. When the lining of your blood vessels, called the endothelium, is damaged, your body struggles to produce enough nitric oxide, and that's often one of the earliest signs of vascular disease. In fact, erectile dysfunction is often an early warning sign of cardiovascular problems. Because the blood vessels in the penis are smaller, they show symptoms earlier than the heart. What the research says about L-Arginine. L-Arginine has been studied extensively. One large meta-analysis reviewed 10 randomized controlled trials involving men with mild to moderate erectile dysfunction. The doses ranged from about 2.8 grams to 8 grams per day. And the results? Men taking L-Arginine experienced significant improvements in erectile function compared to placebo. A more detailed clinical study. In a more recent double-blind, placebo-controlled trial, researchers wanted to see how effective L-Arginine is for different severity levels of ED. Participants took 6 grams per day, divided into 3 doses with meals for 3 months. The study included nearly 100 men split between treatment and placebo groups. After 90 days, the results showed significant improvement in erectile function scores, improved blood flow into the penis, higher peak systolic velocity, which measures how fast blood enters penile tissue, and one surprising outcome. About 24% of men who previously had erectile dysfunction no longer had it after treatment. However, most of these were men with mild to moderate ED. Side effects and limitations of L-Arginine. While L-Arginine is generally safe, it's not perfect. Some reported side effects include headaches, digestive issues, itching, insomnia. There are also some important cautions. It may worsen asthma or allergies. It can lower blood pressure. It may interact with medications for hypertension. In rare cases, it may affect liver function. But the biggest issue? Poor bioavailability. Your body breaks down L-Arginine quickly, which means you need to take it multiple times per day for consistent effects, and that's not always convenient. L-Citrulline, the smarter alternative? This brings us to L-Citrulline. L-Citrulline works a little differently. Instead of directly increasing nitric oxide, it gets converted into L-Arginine in your kidneys. And here's the interesting part. Oral L-Citrulline actually increases blood levels of L-Arginine more effectively than taking L-Arginine itself. Why? Because it bypasses the breakdown process in the gut and liver. This means better absorption, longer-lasting effects, more stable nitric oxide production, additional benefits of L-Citrulline. Some research also suggests that L-Citrulline may stimulate the release of VEGF, vascular endothelial growth factor. This helps repair and grow blood vessels. In simple terms, it doesn't just improve blood flow, it may actually improve the health of your blood vessels over time. What the research says about L-Citrulline. The research on L-Citrulline is more limited, but still promising. In one study from 2011, 24 men with mild erectile dysfunction were observed. These men didn't have complete ED. They could achieve erections, but they weren't strong enough for satisfactory performance. Participants took placebo for 1 month, then L-Citrulline 1.5 grams per day for another month. And the results? About 50% of men experienced improved erection hardness. Their scores improved from level 3, not fully rigid, to level 4, fully rigid. In comparison, only about 2% improved during the placebo phase. Safety profile of L-Citrulline. L-Citrulline is generally very well tolerated. Side effects are rare and usually mild. That makes it an attractive option for men looking for a natural approach to improving erectile function. Key differences: L-Arginine versus L-Citrulline. Let's simplify this. L-Arginine direct nitric oxide booster. Well-researched, works faster, requires multiple doses, lower absorption. L-Citrulline converts into arginine, better absorption, longer-lasting effects. Fewer side effects, less research but promising. Which one should you choose? If you're dealing with mild to moderate erectile dysfunction, both supplements may help, but in many cases, L-Citrulline may be the better option due to its superior bioavailability and sustained effect. Some people even combine both for maximum benefit. Who benefits the most? These supplements tend to work best for men who have mild erectile dysfunction, poor circulation, early-stage vascular issues, lifestyle-related ED. However, if you have severe erectile dysfunction, these may not be enough on their own. The bigger picture. Here's what you need to understand. Supplements can help, but they don't fix the root cause. If your ED is caused by poor diet, lack of exercise, smoking, stress, chronic health conditions, you need to address those first, because no supplement can fully overcome poor health. Final thoughts. L-Arginine and L-Citrulline are not magic pills, but they are backed by real science. They can improve blood flow, support nitric oxide production, and help men with mild erectile dysfunction see real improvements. The key is using them correctly and understanding their limitations. If you found this helpful, make sure to subscribe and share this with someone who might benefit. And as always, take care of yourself, because you're worth it.